This is the one similar to the brightness of the fatty liver. So between the common carotid and the trachea, we see the thyroid gland. And the two lobes, the left and the right lobe, they are attached through this isthmus. We will measure the size of the gland and we will give tremendous importance to its brightness. You have to remember the normal brightness of the thyroid gland, which we don't see in thyroiditis like Hashimoto's thyroiditis and also in toxic goiter. We don't see this brightness. So, this is the thyroid lobe, the right one, the common carotid artery, and the internal jugular vein. Both common carotid artery and internal jugular vein, we will see the pulsations of the heart. So there you see the right lobe. We have seen it from lower to the upper, the isthmus, the left lobe from the lower to the upper pole. We will measure it. There you see, longitudinally and in cross section. You can see the isthmus there and the left lobe longitudinally and on cross section. So usually the length of the thyroid is around 5 centimeter and the transverse diameter less than 2. The anteroposterior diameter also is less than 2. In a thinly built individual, if this anteroposterior diameter is more than 2.5, the gland will become goitrous. And in a thinly built individual, you will be able to see the bulge of the gland. So we have seen the thyroid. Parathyroid glands are not ultrasoundable, but their adenomas are. Now here on the left side, there is a difference which I would like. This is the cervical esophagus, this one. If we go here on the right side, we don't see any cervical esophagus here. It is on the left side. Sometimes we do find if the esophagus is in the middle or a little to the right and a little to the left. But here you can see the esophagus, this round. The white is the lumen here. There is some maybe air bubble inside. So we will see the esophagus now. I'm going to enlarge the image for you. So if we start from the outer side, this is the serosa, this is the muscularis propria, the muscle responsible for the peristaltic activity. Just for your interest, I am measuring it, 1.1 centimeter. After this muscle is a white line, which is the submucosa. The submucosa. And then is that black line, which is the mucosa, and the lumen is white. This is the lumen. Now I'm showing you it on real time. The serosa, the muscularis, the submucosa, and the black mucosa, and the white lumen. The same we can see it on longitudinal. Now you can appreciate. थोड़ा सा इस तरफ देखें, मेरी तरफ देखें, ऊपर को, here, sorry. On the left side of the trachea, you see the ठीक है, थोड़ा सा वापस उधर को, ऊपर को देखें, yes. So my dear, this is the left thyroid lobe, and there you see the esophagus running behind. This is the lumen. This is the proper muscle layer, the submucosa, the mucosa, the serosa. So now I'm going to ask him to swallow air. लो जी, थूक निकले जरा, थूक निकलो, निकलो, थूक निकले, नहीं नहीं, थूक निकलनी है. My patient is unable to understand what I'm saying. छोड़ दो ढीला, ऊपर देखो. जैसे मुंह में से थूक नहीं निकलते, निकलो. नहीं आती निकलनी. थूक अंदर लेके जाओ, ऐसे जैसे पानी पीते हैं. हाँ शाबाश, ये ऐसे करो फिर से. यस, ठीक है. You will notice movement of it. There you see the air. You will see this white line going in this direction. There, yeah. There you see. There you see again. This is it. So this is the cervical esophagus, and you can see the saliva going down. There we are. Okay. There we are. It is going here. This is air bubble, and the saliva was going down. Okay. Normally, the vascularity of the gland is such. So, this is how we find the vascularity of the thyroid gland, which will be seen markedly increased in thyroiditis as well as in thyrotoxicosis. But thyroiditis will end up in hypothyroidism, and the thyrotoxicosis will be producing more amount of thyroxine. So there you are. Normal vascularity. We have seen the blood flow in the carotid, and we also would like to see the blood flow in the vertebral artery. We all know that two internal carotid arteries and two vertebral arteries are responsible for the supply to the brain. So how are we going to locate the vertebral artery? ऊपर देखें, longitudinally you can see the common carotid, and from here I will move the probe laterally, or at times I will just tilt. This is lateral, this is medial. So I am going a little lateral. So thyroid, common carotid artery, we can see on the right side, we tilt the probe to the right side, and we will see now the transverse processes of the vertebral bodies. I'm going back. These are the vertebral bodies, the other vertebral body, and this is the intervertebral disc. There. This is intervertebral disc. This is the body. Keeping this body in focus, I'm moving lateral, and there you see. This is a transverse process. Going back, in the midline are the vertebral body,